Rymed is a combination medication used to temporarily relieve symptoms caused by the common cold, flu, allergies, or other breathing illnesses such as sinusitis and bronchitis. Antihistamines help relieve watery eyes, itchy eyes/nose/throat, runny nose, and sneezing, while decongestants help relieve stuffy nose and ear congestion symptoms. If you are considering using this medication, carefully read the package instructions to ensure it is right for you. Some products may have similar brand names but different active ingredients with different uses, so it's important to ask your pharmacist if you have any questions about your product or its use. Keep in mind that cough and cold products have not been shown to be safe or effective in children younger than 6 years, and some products are not recommended for use in children younger than 12 years. It's important to follow all dosage directions to decrease the risk for serious side effects and to avoid giving other cough and cold medications that might contain the same or similar ingredients. Always consult with your doctor or pharmacist for more details about using this product safely. Remember that these products do not cure or shorten the length of the common cold and may cause serious side effects. If you have any concerns or questions about other ways to relieve cough and cold symptoms, such as drinking enough fluids or using a humidifier or saline nose drop/spray, make sure to ask your healthcare provider for advice. When taking Rymed, you should follow the directions given by your doctor or pharmacist. If you are self-treating, make sure to carefully follow the instructions on the product package. If you have any questions, don't hesitate to ask your doctor or pharmacist for clarification. You may take this medication with food if it upsets your stomach, and be sure to drink plenty of fluids unless otherwise directed by your doctor. If you are using the liquid form of this medication, be sure to measure the dose carefully using a special measuring device/spoon. Do not use a household spoon, as it may not provide the correct dose. If the liquid form is a suspension, make sure to shake the bottle well before each dose. Do not crush or chew extended-release tablets or capsules, as this can release all of the drug at once and increase the risk of side effects. If you are using chewable tablets, be sure to chew each tablet thoroughly before swallowing. If you are using a product made to dissolve in the mouth, tablets/strips, make sure your hands are dry before handling the medication. Place each dose on the tongue and allow it to dissolve completely, then swallow it with saliva or water. The dosage of Rymed is based on the product you are taking, your age, medical condition, and response to treatment. Do not increase your dose or take this medication more often than directed without your doctor's approval. If your doctor directs you to take this medication daily, take it regularly at the same times each day to get the most benefit from it. And be sure to tell your doctor if your condition lasts for more than 1 week, gets worse, or occurs with a headache that doesn't go away, fever, or rash, as these may be symptoms of a serious medical problem and should be checked by a doctor. Some common side effects of Rymed includes drowsiness, dizziness, dry mouth/nose/throat, headache, upset stomach, constipation, or trouble sleeping. If any of these effects persist or worsen, it's important to contact your doctor or pharmacist. Remember that your doctor has prescribed this medication because they have judged that the benefit to you is greater than the risk of side effects. Many people using this product do not experience serious side effects. However, it's important to tell your doctor right away if you experience any serious side effects, such as mental/mood changes, ringing in the ears, difficulty urinating, or vision changes. Seek medical help immediately if you experience fast/irregular heartbeat or seizures. While very serious allergic reactions to this drug are rare, it's important to seek medical help if you notice any symptoms of a serious allergic reaction, including rash, itching/swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so if you notice any other effects, it's important to contact your doctor or pharmacist. As always, it's important to follow your doctor's instructions and take the medication as prescribed. If you have any concerns or questions about the side effects of Rymed, don't hesitate to contact your healthcare provider for guidance. Before taking Rymed, it's important to let your doctor or pharmacist know if you have any allergies to its ingredients. This medication may contain inactive ingredients that could cause allergic reactions or other issues, so it's essential to talk to your pharmacist for more details. It's also important to inform your doctor or pharmacist about your medical history before using Rymed, especially if you have breathing problems, diabetes, glaucoma, heart problems, high blood pressure, kidney problems, liver disease, seizures, stomach/intestinal problems, overactive thyroid, or difficulty urinating. Rymed may cause dizziness or drowsiness, and consuming alcohol or marijuana can intensify these effects. It's important to avoid activities that require alertness until you can do them safely, and to limit alcoholic beverages. If you are using marijuana, it's essential to talk to your doctor. Certain forms of Rymed may contain sugar, aspartame, or alcohol, so if you have diabetes, alcohol dependence, liver disease, phenylketonuria, or any other condition that requires you to limit or avoid these substances in your diet, it's important to ask your doctor or pharmacist about using this product safely. Before undergoing surgery, it's crucial to inform your doctor or dentist about all the products you use, including prescription drugs, non-prescription drugs, and herbal products. Children may be more sensitive to the side effects of Rymed, especially excitation and agitation, while older adults may be more sensitive to side effects such as dizziness, drowsiness, confusion, constipation, fast/irregular heartbeat, trouble sleeping, or urination problems, which can increase the risk of falling. During pregnancy, Rymed should only be used when clearly needed, and it's important to discuss the risks and benefits with your doctor. Additionally, this medication may pass into breast milk, and the effect on a nursing infant is unknown, so it's essential to consult your doctor before breastfeeding. Drug interactions can change how your medications work or increase your risk for serious side effects. It's important to keep a list of all the products you use and share it with your doctor and pharmacist. This includes prescription and non-prescription drugs, as well as herbal products. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with Rymed are antihistamines applied to the skin, such as diphenhydramine cream, ointment, or spray. Taking MAO inhibitors with this medication may cause a serious, possibly fatal, drug interaction. Avoid taking MAO inhibitors during treatment with Rymed. Most MAO inhibitors should also not be taken for 2 weeks before treatment with Rymed. Ask your doctor when to start or stop taking this medication. If you are taking other products that cause drowsiness, such as opioid pain or cough relievers, alcohol, marijuana, drugs for sleep or anxiety, muscle relaxants, or other antihistamines, make sure to tell your doctor or pharmacist. Rymed may also interfere with certain medical/lab tests, possibly causing false test results. Make sure lab personnel and all your doctors know you use this drug. Be sure to check the labels on all your medicines, as they may contain ingredients that cause drowsiness. Ask your pharmacist about using those products safely. If someone has taken too much Rymed and is experiencing severe symptoms like passing out or difficulty breathing, it's important to seek immediate medical help. In the U.S., you can call the Poison Control Center at 1-800-222-1222, and in Canada, you can call a provincial poison control center. Symptoms of an overdose may include irregular heartbeat, hallucinations, fainting, and seizures. If your doctor has prescribed Rymed, it's important not to share it with others. Make sure to keep all medical and lab appointments while taking this medication. It's important to follow your doctor's instructions for the best results. Rymed can be taken with or without food, usually once or twice daily. Be sure to take it at the same time each day to help you remember. If you have any questions or concerns about taking Rymed, be sure to talk to your doctor. If you are using Rymed regularly and happen to miss a dose, take it as soon as you remember. If it's almost time for your next dose, just skip the missed one and take the next dose at your regular time. Do not take a double dose to make up for the missed one. When storing Rymed, it's important to keep it at room temperature, away from light and moisture. Make sure not to store it in the bathroom and refrain from freezing any liquid forms of the medication. Always keep Rymed out of reach of children and pets. When it comes to disposing of Rymed, do not flush it down the toilet or pour it into a drain unless instructed to do so. Instead, properly discard the product when it is expired or no longer needed. You can consult your pharmacist or local waste disposal company for guidance on the proper disposal method. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.